Thank you, Madam President, and good afternoon. I rise in support of this settlement for a number of reasons. First, because it is a pro-job initiative, it is pro-health care, and it also puts an end to expensive litigation, which greatly benefits the taxpayers of our state, hospital workers, and the patients that they serve. So for those reasons, I do stand in support, but there is a part of me that has a large measure of resentment in the fact that I was here in 2011. I was present when Governor Malloy made the promise to hospitals and then broke that promise that has now resulted in this litigation that has exposed our taxpayers to a potential $4 billion problem. Now, how did we get there? And pardon me if I'm going to go back in time, but let's go back 8.5 years to May of 2011, when Governor Malloy was promising shared sacrifice for the taxpayers of Connecticut, shared sacrifice for the government itself, and shared sacrifice for people who depend on government. We heard about social services a few moments ago. That's where Governor Malloy targeted social services. He also targeted the taxpayers of the state of Connecticut, handing them the largest tax increase in the state's history that they continue to shoulder to this day. Government itself, however, did not quite step to the plate. And that's one of the reasons why in that biennium, when we had $3 billion deficits year over year, we solved it allegedly, but we still have them to this day. The taxpayers continue to pay their fair share. The people that depend on government have been cut out. So what's the common problem? If we did solve the problem back then in 2011, we wouldn't be facing the fiscal problems we now have. But it was that governor and his majority that handed that to the people of Connecticut, and the same party controls every lever of government to this day, and guess what? We still have the same fiscal problems. Shared sacrifice, we cut human services. Promise made, promise broken. Back then, when I walked into this chamber, I saw Governor Rell leave. She was the governor that made a promise to people of Connecticut with regards to home care. She instituted Money Follows the Person, which recognized that home care was better than institutional care. And it was a legislative acknowledgement that that was the way our state should go. We put in place that program. And she also recognized that by increasing what was known as the community spouse allowance to allow a community spouse with a spouse in a nursing home the maximum benefit under the Medicaid program. Governor Malloy, her successor, in his first term under this shared sacrifice, cut that in half. That has never been restored to this day, and in fact, I have watched over the last 8.5 years a retreat from home care initiatives to the point where right now in this current budget, we are cutting the Medicaid reimbursement rate to certain skilled nursing facilities, while at the same time cutting the Connecticut home care program, which we have closed to Category 1 individuals who are at the beginning point of aging in place initiatives. Talk about retreat from the people we serve. And so now we're going to come here and have to clean up this mess. Talk about grinding my gears. That's what this does. But that's what we have done here. We make promises. I shouldn't even say we, because I haven't voted for these. Governor Malloy and his majority, after Governor Rell made that promise, broke the promise. We got to focus on things today. I'll give you one. The special or the personal needs allowance. Let me explain what the personal needs allowance is. Personal needs allowance is when somebody has gone into a nursing home They've given up their home. They've given up all their assets, their 401k, their retirement, their pension, their Social Security. They have less than $1,600 to their name, and they, under Governor Rell, got to keep $70. That was cut to $62. To save $1 million. 8.5 years ago, I thought it was an unkind cut. It remains an unkind cut to this day. And even 6 months ago, I was told, wait. And I didn't like it then because the average length of stay, the average length of life expectancy in a nursing home in Connecticut is about 2.25 years. These folks have been waiting 8.5. We still haven't fixed that problem today. $1 million is what it would cost. We are going to fix Dan Malloy's problem with an $872 million fix. And we couldn't find $1 million for this population, many of whom suffer from Alzheimer's and other chronic illnesses. Talk about a population that doesn't have a voice. Well, let me tell you, that's why I keep bringing it up. And this can be fixed. Every year, past 2 or 3 years, I've been putting in a bill that deals with a Medicaid fix, which is what we're talking about with this bill, so it would have been germane, that would have recalculated applied income when you're dealing with conservators in a probate court. Conservators are needed in a probate court when somebody can't handle their own affairs. Somebody who might have Alzheimer's, somebody who might be in a nursing home. And with a simple adjustment, we can leverage Medicaid dollars like we're leveraging Medicaid dollars in this hospital deal to bring an extra $800,000 to Connecticut per year. But there's no appetite from DSS. We could fix that now. Why are we making this population wait? I don't get it. Another population that's waiting, middle-class Connecticut that's paying too much for their insurance premiums. People today have insurance premiums that rival their mortgage. That's due in large part because the Affordable Care Act didn't properly fund the promises that they made. And they broke one because they didn't put the proper funding in place, which is necessary to keep premiums low. I've put forward a bill, reinsurance, in order to do this, something that the exchange itself agrees with. It would cost about $19 million to reduce premiums 5%. We can go as high as 20%, but we have to find the funding. Once again, we can find $872 million like this, but when we come up with the initiative, oh, you got to search the budget. You got to find it somewhere else. When UConn wanted to leave the conference it's in to go to the Big East, oh boy, did we find $20 million quicker than hurry up. What about Connecticut families that can't afford health insurance? Where do they factor in? I thought there was a promise made that we were going to have affordable, accessible, and quality health care. Nope. Wait. Again, the people have to wait. I couldn't agree more with Senator McCrory when he talked about no initiatives to lower health care costs. We could have put that here too. We didn't. Nor did we look at emergency room readmissions. And many times, people need, I'm going to say, a social model to deal with, and they go into an ER, and they get a prognosis and need to get medicines that go with that. Maybe their family budget doesn't quite have the funds to afford the prescriptions they need. And when they don't take the prescriptions they need, we have more expensive health outcomes. By putting a proper community health worker in the ER to deal with this population, guess what? Maybe we can help bring a social model to find the necessary funds so that they can get the medicine and prescriptions that they deserve. That's not in the bill either. But yet, we find the $872 million real fast. But when it comes to Connecticut's middle class, when it comes to Connecticut's human services, when it comes to people that depend on government itself and the core services that are necessary, well, no, they can wait. I gave you the example of the personal needs allowance. It's $1 million, a lousy $1 million, and I've even given you the idea of where we can find it in the budget and make that work today. We shouldn't have to wait. And God knows the people in nursing homes can't afford to wait. Madam President, while I have these reservations and concerns, overall, as I said at the outset, this is a pro-job initiative. It is pro-healthcare because it's going to afford us the opportunity to have the best quality hospitals and healthcare system so that when our families need healthcare, and when we talk about emergent conditions to go to the hospitals are there and they're staffed with the best and the brightest and the most capable in the healthcare industry. And as I said at the outset, this will avoid the legislation or the litigation and avoid that $4 billion sword of Damocles that's over the taxpayer's neck. So for those reasons, because it benefits the taxpayer, because it benefits hospital workers, and because it benefits Connecticut families and patients, I am going to be supportive of this initiative. Thank you.
Thank you, Senator Kelly. Will you